All right, so we're recording. So welcome everyone to the April Connect Lunch and Learn. We will be hearing from behavioral health providers in the community. This is certainly not everyone, but we'll be hearing from a few. And then we'll have time at the end to just do some introductions, and folks from other agencies can share what they're up to. So first, I'd like to have Jennifer Preble from the Center for Mental Health share about the center services.
Thanks, Julie, and hello, everybody. Center for Mental Health, I am the licensed program supervisor over our recovery services, which entails outpatient therapy, case management, adult therapeutic aid, peer support, and that's for all 13 of our service counties. And so I am, very busy, shall we say that. And as far as, Julie, do you want to know like what capacity we use Connect and those pieces, or just a general overall update? Trying to distinguish the difference between our Tuesday HRA meetings and this meeting. And
yeah, so this is open to all Connect users. So I want this to be who you are, what you do in general, and when someone might want to refer a client to you.
Perfect. So, I mean, anytime you want to refer a client, we have been on Connect for quite some time. Julie and I spend a lot of time talking about the older versions of Connect and how it is now. We have some barriers to Connect that we're still trying to navigate, especially with the administrative support of watching those referrals come in and get those processed. And generally from other behavioral health providers, healthcare facilities, primary care, we end up still doing a lot of fax and phone calls because people typically send an ROI and release the records to us for us to call and outreach the individual or the client or patient. So we're still in that middle ground of we still get both. We are not receiving a ton of Connect referrals at this point, nor are we doing many. I imagine a lot of COVID issues have some impact on that. And we certainly are looking at, and I'll just do a plug-in for that as well, with the emergency disaster planning. There is a functional group for behavioral health looking at this piece, and it was just decided yesterday that we're going to pursue having a centralized location to do provider referrals back and forth for disaster relief and planning during crisis, especially to help expedite folks getting into services. We've got a lot of information and working pieces to get that going, but also to have a public access link, which would allow citizens that aren't connected to any provider to do a referral. They will be able to access it and have a person help them navigate that referral system and hopefully get services within 24 to 72 hours. So those are kind of some of all of the pieces that I have direct impact on. And as Julie said, I will be exiting right here real quick because I've got another meeting that I'm committed to, as well as traveling out to Camp Child, as we just discussed and Judy was sharing from the YMCA, providing some behavioral health support to our alternate shelter location for homeless families. So I, as well as many other agencies represented here, will be helping assist in that process.
Great, thanks, Jen. Are there any questions for Jen about Center for Mental Health before she has to dash off? And if you do have any, feel free to route them to me and I can route them to her if you don't know how to find her. So thank you so much for being here.
Yeah, definitely. Any questions, or as you guys explore other topics, if I miss something, feel free to reach out. Julie knows almost where I live, so. Thanks, you guys.
All right. Next up, do we have anyone from the St. Peter's Behavioral Health Group? Great. Bernadette, can I turn over to you?
Five behavioral health specialists that work in the primary care clinics. So we are able to see people that are referred and work with our primary care providers. Um, Julie, are you getting any referrals from the behavioral health unit through Connect, or not necessarily hospital services?
Behavioral health unit is not on yet. So I was hoping that you'd be able to speak to in general, like what kind of work you do with the patients and how you help. I know you do a lot of navigation of all sorts of various, needs with them. So I was hoping to speak along that.
Okay, so yeah, through the integrated behavioral health that we're doing in the clinics, you guys, it's a lot of, we can see people short term, but if people have longer term needs, then we try to refer to the community. So that's when we use Connect referrals, and we have a lot of referrals that we do send out to the community.
Great. How are things going over there? I know we're all thinking of you.
Oh, thank you. It's very, it's been quiet in the clinics because we've gone to virtual care. So the providers are all seeing people virtually. Just a few people come into the clinic, and then we'll be moving back to accepting people back into the clinic in person slowly. But I think we'll probably always do some work from home now, you guys, some virtual therapy sessions, telehealth sessions, more so than we did before.
Questions for Bernadette about the St. Peter's groups of the nurses and case managers on that team?
I have a question. Is it just adults mostly, and then children get referred to Shriners or somewhere else?
Thank you, Liz. No, we have 5 family practice providers too. So
Okay.
we have people of all ages. So the behavioral health professionals work with the nurse care managers and social workers to try to just do a team approach here. And so it's all ages.
Okay, that's good to know. Thanks.
Great, thank you. Any other questions? And again, if there are other questions, I'm happy to help route them to the right person. So great, thank you so much, Bernadette. Jason, I'll turn it over to you and to speak about Helena Indian Alliance Behavioral Health Services.
Hey, Julie, how are you?
Sorry, unmute. Good.
Oh, that's yeah. That was a delay. I was thinking we had a delay. Yeah. So, my name's Jason McNeese. I'm a behavioral health peer support specialist at the Helena Indian Alliance in Leopocha Clinic. I'm joined today by Lisa Rosales. She is our MAT coordinator and our ex-waivered FNP's MA. And this and that and the other. She wears many hats. So she's going to kind of speak a little bit about some of the additional medical services that we offer on the clinic side at our facility. So I guess, Julie, can you kind of let me know what exactly you're wanting us to speak to, kind of like behavioral health services during COVID, or?
Sure.
Okay.
When I set out to schedule this initially, it was just in general, what do people need to know, but also what do people know in times of COVID. So for folks in the community, kind of here's how I'm thinking about it, and I'll try to introduce this at the start and going forward, is that for folks who haven't heard of your services and when they're working with their own clients, when might they want to get someone involved with your agency and your program? Kind of what do you provide, just for folks who don't know yet?
Okay, wonderful.
Your programs.
Yeah, we're a one-stop shop, right? So we have kind of everything here aside from dental. So recently we became an FQHC lookalike. So we're kind of under that same designation as PeerView and provide similar services. So we do have the title Helena Indian Alliance, although it's not Native American specific, right? Our demographics look kind of like 60% non-Native, 40% Native American in our behavioral health services, and then the opposite of that on the medical side. So more like 60% Native American in the medical services and 40% non-Native. Behavioral health services range in a wide variety. So we have several LACs, I believe 4 or 5, an LCSW candidate currently, 2 LCPCs, 2 behavioral health peer support specialists. And then Tara Wells is a family lifespan nurse practitioner, and she specializes in mental health also. We have a psychiatric nurse practitioner who helps with medication management, and a big staff. I think there's a little more than 30 of us in total right now. So our process kind of works like we have walk-in clinic twice a week. Those hours have kind of changed over the course of time. And currently, right, during COVID, we're not necessarily doing that. We may do some intakes with face-to-face visits if individuals come to our facility. And then individual would come in, see the nurse practitioner. We have several of them here, and then receive the referral to either addictions counseling or mental health services, whichever one is appropriate, and peer support if there's an immediate need for that. From there, they would be staffed and assigned to whichever LAC or mental health professional. Currently, we don't have a mental health wait list, and our assessments with the licensed addictions counselors are fairly rapid also. So moving to more of an integrated behavioral health care model and trying to have that available immediately if people need that is ultimately one of our overall goals. So that's really neat to see someone be able to come in and see the nurse practitioner. So say that it's someone experiencing opioid withdrawal and looking for medication-assisted treatment services. They'd be able to come in, see their nurse practitioner, have warm hands off to the LAC, be able to begin like that initial assessment, maybe learn some safe and healthy coping skills, have a warm handoff to peer support specialist to help work with, housing needs, Medicare, Medicaid, additional, support and healthy coping skills. And then we have Julie Burrows also, who can help with their Medicare, Medicaid, SNAP benefits applications, housing. So the idea is that we'd be able to kind of do all of those things just like in that one day, right? We do have ACT and Prime for Life here also. So we currently have been doing those through Zoom. There's an online workbook that the participants are able to download. I believe Robert Bigback is engaging one of those classes today and tomorrow. So that's been kind of a cool thing to be able to see that we're still able to provide all of these services through telehealth or secure video conferencing. Yeah, I've seen an increase in crisis-related response pretty significantly just within the last 10 to 14 days. So those first several weeks were pretty steady. But just over the last 10 to 14 days, there's been a large increase in individuals that are experiencing kind of like suicidal ideations and in crisis, attempting suicide. Not so much episodes of use, but more abandonment or difficulties with detachment from their family members and friends. So personally, like my visits and peer support overall, we've seen an increase in the number of visits that we've had on average over the last several weeks, which is kind of cool to see that people are able to be more comfortable in their homes and on the telephone or through secure video conferencing and able to engage more often. Yeah. Did anyone have any questions about our behavioral health services specifically?
I have a question. It's not necessarily, I was wondering about, and I don't know if you know anything about this, Jason, but I heard that there was a lawsuit being put forth by a Native American community because they weren't getting the funding that they needed for COVID testing. And I was wondering about what's happening with the Native American community in Montana with testing and numbers. I was just curious if you have any information about that.
I don't have any specific information about that. I would refer you to Kevin Sandoval. He wears many hats here also, but he's our business office manager, and he has access to a lot of statistical information and follows different tribal city and community grants. And so he would be the best person to reach out to, just using our just like our regular number is 442-9244, and then Kevin's at extension 103. So he might be able to answer that question. As far as within our setting here, we were last updated a couple of weeks ago and have several different funding streams that they're working to navigate. So as far as testing availability goes in the clinic, I believe Lisa would have better answers to that question there. And as far as so having the ability to support our Native American community and individuals in the Helena area, we've really been really enabled to be able to do that. So by doing additional telephone outreach, connecting persons to services that need those kinds of services. So whether that's, home prescription or food delivery services. Michelle Jones is a peer support specialist here also. So she's been making a lot of those telephone calls to our elder population or those that may be in higher risk categories and ensuring that they're connected to the appropriate services that they may need during this time. As far as reservations and across the rest of the state, I've heard that. I briefly read a small article about testing and then having limited or no access to clean or running water on one of the reservations during this time. And so I haven't had the opportunity to do a lot of personal research on that. But yeah, reach out to Kevin. He'll be a long answer short. Call Kevin.
And also, I just thought of I have a patient who she said that she'd be happy to help people who need help with like food delivery or errands or anything like that. And so do you guys have a need for that? I could plug her into that possibility if you have a need for another person to help.
I think there's always a need for that. Yeah,
Okay.
definitely. If we
would I have her talk to Kevin?
No, I can put my email here in the chat, and you could email me, or you could give her my email in contact information.
Okay. All right.
We've had several different requests. Like one family needed fuel, so they needed wood to burn in their wood stove, and one of our community members went and got a load of wood and took it out to that family. We've had families that did need like additional groceries or prescription medications and weren't able to access those. So any of those kind of requests we get, the more resources that we have at our utilization, the easier it makes it
okay.
for us to be able to get them those resources. So yeah.
I'll put her in touch with you, and then she can decide if it's an area where she wants to pitch in and help.
Beautiful. Thank you so much.
Yeah, you're welcome.
Great. Thanks so much, Jason.
Is it okay if to pass it over to Lisa Rosales to talk a little bit about our MAP program?
Yes, let's do that.
Beautiful. All right, you're up, Lisa.
Having trouble hearing you. Is your computer muted on top of Zoom? Still no?
Oh, that's unfortunate. So, we can't hear you, Lisa. So we have a medication-assisted treatment program here. Tara Wells is our X-waiver nurse practitioner. We also have another X-waiver provider. Morgan Pedersen recently received her X-waiver. We do intake and induction here during walk-in clinic times. Lisa is our MAT program coordinator. We've recently moved to doing a group MAT program, so everybody.
Can you hear me now, Jason?
Oh, hey, there we go. All right, you're up.
Sorry, guys. So my name is Lisa Rosales, and like Jason said, I do wear many hats at the Leopocha Clinic, like most of us do. I am Tara's assistant, as well as the MAT coordinator, and starting to do some IT stuff in the clinic. Just to add a little bit to what Jason had said before, we are kind of a one-stop shop with services that we provide within the community. We do have 2 X-Wave NPs. Morgan Pedersen is kind of helping us when Tara is out or we need some help. And then Tara is our MAT and X-Waiver provider. We are currently taking new patients for our MAT program. We really prefer them to come into the clinic and do their intake with us. And then after that, we do it via Zoom or phone, depending on the patient. The intake takes about a half hour. We like to talk to them and get some stuff or get some questions answered with them. They start with a week with us weekly for a while, and then go bi-weekly, then monthly, then quarterly. While on our MAT program, we do like to have them participate in our MAT group, which is every Wednesday, and then see a LAC and a peer support specialist. And yeah, that's really all I have for our MAT program.
Great, thank you, Lisa. Any questions for Lisa about the MAT program? Great. Well, thank you both so much for sharing about what you're up to. And I'll ask next that we'll have Bob Funk with the Awareness Network to speak about that program.
Hi, everyone. Can you hear me? Okay, just making sure. As she said, my name is Bob Funk. I am the board president of the Awareness Network. Really excited to be connected with all of you. The Awareness Network, I just wanted to sort of introduce ourselves to this group. We are a volunteer-based nonprofit here in Helena. We started in 2015. Initial mission was to combat stigma, especially around behavioral disorders. As we did more work and education opportunities, we learned that one of the biggest barriers to people seeking treatment, as everyone knows on this call, was cost, and filling that gap, even for people who have insurance. But we know that there's not a lot of parity between physical and mental health insurance. So what we do is we provide basically no questions asked. There's an application process, but financial aid for youth under the age of 25 and their family members. So we work with partners from Shodair, Intermountain, private counselors, school counselors. So we're really excited to get put into Connect. Julie's been working with me on this. Unfortunately, my day job with COVID-19 has overwhelmed a little bit, so we've kind of had to stick with our old system, but we're really looking forward to getting plugged into Connect. If you go to awarenessnetwork.org, you can find our very simple financial aid request. We are liking it more and more to come from actual providers. We don't need a lot of details. We don't want to add another layer of bureaucracy to the healthcare system in Lewis and Clark County. We just want to make sure any kids and their family members, because often we know that there can be co-occurring mental health issues in a home. are getting the treatment that they need. So if you have clients that fit the group that we're servicing that need financial aid or could be accessing more mental health care services with financial aid, please have them contact us. Again, very simple application form. We don't ask a lot of questions. We just want as many people, especially now, to get the treatment they need. Also, while during COVID, we are offering we're offering subscriptions to mental health apps. We know that obviously a lot of young people spend a lot of time on their phone, and especially with telehealth and all of that, we just thought that was another way for us to help. So as long as it's an app that's recommended by the Anxiety and Depression Association of America, we'll cover that subscription. We also will cover the costs of workbooks, all of that kind of stuff for at-home care or to supplement the services that you all provide. We've been primarily doing that with schools, but we have had counselors and therapists that have contacted us and asked us to buy, CBT. We're not doing CBD yet, but CBT workbooks, for example, for a number of their clients. So that's one aspect we're doing. We're also really excited to be, we're in the middle of getting an MOU put together to work with Lewis and Clark County with promoting the suicide prevention trainings and mental health trainings. But really what I wanted to talk to you all about was the financial aid that we offer. And things are starting to settle down a little bit. So either me or the person that runs our books will be getting us put into Connect. So hopefully that simplifies the process for everyone. But in the meantime, awarenessnetwork.org, we move around, we move very quickly. I think if you talk to any of the healthcare providers I mentioned on here, this call, see that we're very easy to work with. So really appreciate the opportunity to jump on here and talk about us a little bit. And I'd be happy to answer any questions about what we do or clarify anything here. I'm trying to stay to the 3-minute period. But
Right, thanks so much. Any questions? Great. Well, thank you all. I'm going to take a minute and just do a Connect update. So business as usual with Connect, and I want to remind everyone in your work that might be over the phone or computer screens with folks, Connect has that text option to get your client's signature on the release information. So you're still able to send referrals even when you and the client are not in the same place. And we've got that agency report. If you have questions about how to find it, just let me know, and I'm happy to walk you through anything. The agency report can be a big help in helping you figure out who might provide this type of service that I'm looking for my client. At this point, I want to see if anyone else who has not yet spoken wants to introduce themselves and talk a little about what they're up to in the world with their services. So I'll just open the floor for that.
Well, I'll talk a little bit about me. I'm a naturopathic doctor, and a lot of people come to me. They might not come to me for anxiety or depression, but they have anxiety and depression or sleeplessness. And my name's Liz Cavan, and I've worked a lot with botanical medicine. So I think the way I could help is if somebody is interested in natural health care, I can help them navigate what herbs would be safe to use with medication, because sometimes people don't understand that. And also nutrition, I feel, is really, really important. And sometimes people are open to changing their nutrition and other times not so much. The big barrier is cost, because I'm not allowed to accept Medicare or Medicaid as a naturopath, but I've been considering doing some pro bono work. I'm always open to helping people with that part of it if cost is a barrier, because mental health is near and dear to me because I have some family history with that, and I want people to get help. And so, yeah, I think that's where I could fit in. I wish I could accept Medicare or Medicaid, but I'm not allowed to, or even TRICARE for that matter. But I'm willing to work with people if they're committed to making change and getting better. So that's all I have to say. And thank you all for the work you do, because the people who have behavioral health needs really need all of you. So thank you.
Great, thanks, Liz. Susan, do you want to introduce yourself?
Sure, I'm with Family Outreach, and we serve children 0 to, well, I'm in the youth area, so we do generally 0 to 16, and then we have an adult program that goes 16 on up. We're for families, we serve families who have children with disabilities, and for those children who are under 3, we're a mandated service. So that means there's no wait list. So if a child meets the criteria for having a disability, and how we decide that is there are 5 areas that we assess in, and if they have either a 25% delay in 2 of those areas or a 50% delay in 1, we can take them on. And then what does that mean? Well, we have a family support specialist, which is what I am, who goes to the house, or right now is on the computer, and we help do a lot of helping them find the resources that they need, therapists of different types, OT, PT, speech, mental health, if that's one of the issues. We have a large percentage of our population is low income, so one of the things we work on is making sure they've got those financial resources that they need. And obviously, since we're in the home and we may have some at least impression, if the parent hasn't told us, but impression of mental health illnesses, then we do try to help them access those resources that are out there. So this is really helpful to me to hear what's in the community. Does anyone have any questions about us?
Thanks so much, Susan. Megan or Erin, if you folks are on, would either of you like to introduce yourselves?
Hi, this is Erin. I'm from CTI. So our programs are employment and training focused, which is quite interesting right now, current situation. My program specifically is a Pathways program, so we're working with families who are on TANF, public assistance. And the reason why I jumped on today is just because we are seeing a lot of need for our TANF folks. You know, they're in difficult situations anyways due to income barriers, but now they're finding themselves even more hard pressed for resources. And so in doing case management with folks by phone and by text and email, we're just hearing a lot of need for behavioral health services. So just wanted to jump on today and really see, you know, what's available to people right now. I'm glad to hear that people can really access things by telehealth and by the video conferencing. That's really amazing for our folks to be able to still access things at this point in time. So we'll definitely be sending folks out to some of the resources we've heard about today. We, you know, in our office, we're, like I said, not currently seeing people face to face, but we are still providing our case management services. So doing our best to help people out there get the resources that they need in any means that we can. Thanks.
Great, thank you, Erin. Megan, are you on and want to talk about Montana Legal Services? She may have stepped away. It looks like we have Linda and Katie as well here. Would either of you like to speak about what's happening on the nurses side of Lewis and Clark Public Health? Well, they are our rock star nurses at Lewis and Clark Public Health. And I, for one, am very grateful for all of what they're doing. So I'm not seeing anyone else come off mute. So at this point, I will wrap us up. Are there any last, oh, they don't have a microphone over there. Okay. They said they're not on audio, but I'm gonna put in a applause for the Lewis and Clark Public Health nurses. So thank you for everything you're doing. Well, at this point, let's wrap up, and I will hopefully see you all at the next Lunch and Learn, which is yet to be scheduled, but we'll get that going. And as always, feel free to reach out with any Connect questions, and hope you all have a great weekend.
Thanks, Julie, for the work you do.
Bye.
Thank you, Julie. Thank you, everyone.
Bye.
Bye.